All right, here we are going to start talking about joints. There are several different types of joints. When I say the term joint, you typically probably think of like the knee or the elbow, and they are very classic examples, but there are many other different types of joints, and here we're going to talk about them and give examples of them. So, first joint type is going to be our fibrous joint. A fibrous joint is going to hold bones together. Actually, hold on, backing up. What is a joint? A joint is where two bones meet, simply put. One of those types is a fibrous joint, and when the bones meet, they're held together by collagen fibers, extending from one bone into the matrix of the next bone. There are no joint cavities, meaning there's no real joint spaces or buildup around them. So it's not like an elbow or a knee joint. Where would I find these types of joints? Teeth, skull sutures, the distal end of the radial ulnar joints, the distal end of the tibiofibular joints, and that's actually what's shown in this picture, is the tib-fib joint. They are held together by collagen fibers, and that's it. Skull sutures, what are those? The plates of the skull where those various plates meet, that's a suture joint. So when you're in the lab looking at the skull, make sure you take a look at those lines. These types of joints are pretty immovable, meaning there's not a lot of motion that's going to be found in them. There we go. So sutures, as I mentioned, these are dense fibrous connective tissues in between the plates of the skull. Syndesmoses, what are these? Syndesmoses are going to be ligaments or membranes holding the bones together. Tib-fib would be an example of this. And gomphoses is the term that we give to a fibrous joint found where the teeth or tooth roots attach into the jaw, the bone of the jaw. Cartilaginous joints. Changing the pic size. Anyway, cartilaginous joints. These are going to be joints that, again, really don't have any special structures around them. They are where two bones meet, and they're going to be held together by cartilage. So examples of this are going to be the epiphyseal plates of your long bones, especially if you haven't finished your growth spurt yet. The ends of the ribs where they meet the sternum, the costosternal joint, that's a cartilaginous joint. Where the two bones of the pubic symphysis, which is the bottom of the pelvis, it's actually shown in this, that is a cartilaginous joint. There is cartilage right in here. And then the big example of this is the intervertebral discs, or the squishy cartilage pads between your vertebrae. So terminology associated with the cartilaginous joints is going to be synchondroses. This is going to be a hyaline-based cartilage connection. So for an example, the hyaline cartilage at the epiphyseal growth plate, or connecting the ribs to the sternum. Symphyses is going to be a hyaline and fibrocartilage joint, such as what is found connecting the two pubic bones. We also have a joint type known as a synovial joint. Now, a synovial joint is your classic joint. It is where two bones meet, but there's a little bit of a space separating them. In this space, you're going to have cartilage on each end of the bone, and you're going to have fluid, usually in the form of synovial fluid. This fluid is going to act as a lubricant, allowing the two bones to glide over each other in a smooth motion. So for synovial joints, think your shoulder, your hip, your knee, the carpal interphalangeal joints. So where your carpal bones, your wrist bones, meet the bones of your palm of your hand. What makes a synovial joint a synovial joint? Well, they're going to have 5 structural characteristics. 1, they're going to have articular cartilage. So cartilage covering the ends of the bones. This cartilage is typically going to be in the form of hyaline cartilage. 2, they're going to have a capsule. They're going to have a membrane, a double-layered membrane that surrounds the ends of the bones and encapsulates this joint area. The outer layer is going to be dense, irregular connective tissue and be continuous with that membrane of the bone. The inner layer is going to be a synovial membrane made up of loose connective tissue and is going to be what secretes the synovial fluid. It is going to cover the entire lining of, everything that's in the capsule except for where there is cartilage. So any exposed bone, the outer membrane, all of that will be covered by the synovial membrane. There will also be a space between the two ends of the bone, and there will be synovial fluid. It's that fluid that is going to allow everything to flow over each other smoothly. Here's the thing though, synovial fluid becomes less viscous, meaning it becomes less sticky as joint activity increases. So it actually does its ability to do its job goes down as you increase your activity, as it warms up. And then there are going to be reinforcing ligaments. So within this joint capsule, we will find ligaments connecting the bones to each other, running in a variety of different directions to help keep the joint together, help keep the bones together. Now, you've probably heard of people say, oh, I'm double jointed, and then usually like bend their knees backwards or pop their fingers in funky directions. Essentially, what is occurring with double jointedness is they don't have two joints. There aren't two joint spaces. What is occurring is the ligaments in that joint space that's being hyperextended or abnormally moved. Those ligaments and the joint capsule itself, that membrane, are extra stretchy. So instead of having a slight rigidity to them, they're all loosey-goosey. And that is what is allowing that double jointedness. It can be problematic, a little double jointedness in one or two joints, depending on the joint, might not be a problem. But if every single one of your joints, or the majority of your joints, has this double jointedness, you're going to have instability at your joints, which means your shoulder will just randomly pop out of place. You'll randomly dislocate it. Your fingers will randomly dislocate. Your hip may randomly dislocate. And it's going to be problematic in doing anything. Can I go on this hike, or will my hip dislocate halfway through it? Am I able to pick up this box? Strength-wise, yes, but will my shoulder randomly dislocate? So double jointedness, as kids, we're like, haha, look at this. But as an adult, it can be very problematic. And there are a variety of conditions, including EDS, or Ehlers-Danlos syndrome, where this double jointedness is highly problematic. All right, so that's going to cover our major joint types. Our next audio is going to cover examples of the different types of synovial joints. So not all synovial joints are created equal or have the same motion/shape. So that's what the next audio is going to be about.